The U.S. Navy hospital ship Mercy sailed into Los Angeles harbor equipped with 1,000 hospital beds and 800 medical staffers. They will treat patients who do not have COVID-19, freeing up space at LA hospitals for an expected surge of coronavirus cases. The U.S. now has more than 100,000 confirmed cases.
At its capacity today, we'll add a third more available beds, and at full capacity, 2/3 more beds to the fight here in Los Angeles.
California Governor Gavin Newsom thanked President Donald Trump for facilitating the ship's deployment. He says the numbers of coronavirus cases and deaths will rise steeply over the next 3 weeks.
They're seeing surge numbers that put them on track within a week to be in line with where New York City currently is if they see the kind of increases they experienced yesterday.
New York City is the country's hardest hit location. Doctors there say they don't have proper equipment to care for sick patients.
Every time that I leave from the ship, I'm just very frustrated because we are doing everything that we can to help everyone, to see everyone, to treat everyone, but we have limited resources and not as much support.
New York Governor Andrew Cuomo says the peak number of cases is still weeks away.
Now we're looking at about 21 days for a possible apex. So we want to do everything we can to be ready for that increased capacity that could hit us in 21 days. So I say, my friends, that we go out there today and we kick coronavirus ass. That's what I say.
The motion is adopted.
In Washington, Congress passed a $2 trillion emergency aid and relief bill.
This bill is the most consequential piece of legislation that many of us will ever vote on. The American people need help, and they need it now.
The bill gives bailouts to major corporations affected by the pandemic, extends unemployment benefits, and provides cash payments to families. President Trump quickly signed it into law.
This is going to save companies that are incredible companies, but that are going to need some help because of what happened. A month ago, they were outstanding. They were having the best year they ever had, and then we got hit. And so we'll help them out. It's thousands and millions of jobs.
Trump repeatedly praised his coronavirus response.
The federal government's done a hell of a job.
In spite of Trump's boasts, new hotspots are emerging in Chicago, Detroit, Dallas, and Philadelphia, a disturbing sign of things to come. Rob Reynolds, Al Jazeera.
Well, let's talk to Marcus Plesher. He's Chief Medical Officer of the Association of State and Territorial Health Officials. He joins us via Skype from Charlotte in North Carolina. Marcus, the US now has more confirmed cases of the virus than any other country, over 100,000 infections. Are these numbers telling us that the US is currently failing in its testing and containment strategy? And if so, why?
Well, we've had some challenges with the testing and containment strategy up to now, but I think what we're seeing is what we expected. This is an international outbreak of a novel infection, and it's spreading across the world, and it's here in the United States now, and we've made attempts to contain it, but we've moved now to a point which we call community mitigation, which we're really trying to control the spread in the communities across the United States, and that's the situation that we're in now.
Marcus, we've seen growing tensions, though, between state governors on the one hand and the federal government on the other. Is that tension getting in the way of what medical professionals like you are trying to do on the ground?
Well, the United States has a public health system that is based on the activities and jurisdiction of state governments. And so that's what you're seeing fall into place now. And I think that system has worked well in the past, and I think that as we watch, state governments are stepping up. They have the capacity, they have the expertise to do what's necessary to intervene with this situation. At the same time, they're working closely with the federal government, and that's what's going to need to happen going forward. And frankly, that has been happening so far, and that's a good thing.
Well, many state governors would perhaps disagree with you, Marcus, but many health professionals are saying the lack of medical supplies in the US, and in their words, is a national shame. I mean, President Trump has now invoked the Defense Procurement Act, which forces companies like GM to make ventilators for the federal government. But is this too little too late, do you think?
Well, I agree. The issue that we're having with protective equipment for health professionals is a major problem, and we have to overcome that. We're doing everything we can in the United States to increase manufacturing of this equipment. We do have a strategic national stockpile. We have a supply of various medical equipment that's kept in reserve for a situation like that. That stockpile has now been opened up, and it's being disseminated out to the places that are the most in need. So there is the potential for some increased equipment in those areas, but we're really counting on more supplies to come in from manufacturers and other sources. I mean, this is
okay.
Probably the greatest thing facing us.
Marcus, just a final point to you. We're now hearing that the US State Department is looking to hire medical staff from abroad. But let me ask you, is this likely to help or hinder the US medical response on the ground, do you think?
No, I think this would be a huge help. I mean, we have hundreds and thousands of foreign-trained physicians who presently work in the United States and do a fantastic job. And I think that the new State Department openings really are intended to look for opportunities for other well-trained physicians across the world who are willing to come and work in the United States to have the opportunity to be able to do that.
Marcus, I'm going to squeeze in one more question because we've got time. Can you just give us an update on what's happening in US hospitals generally at the moment?
Well, the hospitals that we're most concerned about are the hospitals in New York City. That's where we have the greatest number of people who are being infected by the coronavirus. And, we're seeing those hospitals become very, very busy. We're seeing areas of New York City that are reaching capacity. And we're all very, very concerned about that. I mean, the hope is that some of the social distancing interventions that have been made in New York City that are very aggressive will start to take effect. We also, we have an excellent workforce in New York City. We have excellent hospitals there. We have an excellent public health system. We have a community of people who are tough. And so we're hoping that those things will help to counter what we see as the potential for a huge increase in cases and for many hospitals to become very crowded and very taxed at this point.
All right, Marcus Plesher, we have to leave it there. Thank you very much indeed for sharing your thoughts with Al Jazeera. Thank you.
Thank you.